Have you heard about stem cells and wondered if it might be a good thing for you, but you have no idea where to start and you're confused by all the terms? You're not alone. My goal in this video is to help you understand more about the field of stem cell injections, some of the research out there, and the types of questions that you might want to ask before you would proceed with something of that nature. We're also going to talk about some of the non-invasive ways to increase your body's production of your own stem cells. But before we get started, be sure to subscribe and hit the notification bell so that you are notified each week when we are releasing our fresh new content. Trust me, I've got some exciting things planned for the next 4 to 5 weeks, and you don't want to miss out. My name is Dr. Brandy Rose Lipscomb, and I am a naturopathic doctor. I practice medicine in Arlington, Washington, and I run 2 different online programs for individuals with chronic pain, as well as teaching doctors how to utilize dynamic neuromodulation to treat their patients more effectively when they have chronic pain issues. So first of all, what is a stem cell? Well, a stem cell is a cell that is able to divide into other types of cells. And we talk about a stem cell being a pluripotent stem cell, which means it's able to divide into almost any cell type, or a multipotent stem cell, which means it's able to divide into certain cell types, but not all 200 different cell types that we have in the body. So a stem cell has the ability to become a chondrocyte and regrow cartilage. It has the ability to become an osteocyte and rebuild your bone. It's so exciting to think about what stem cells can possibly do for us. And one part of our body that never stops producing stem cells is our bone marrow, where we produce hematopoietic stem cells, meaning stem cells that become our blood cells, our red blood cells, our white blood cells, our platelets. Even if you're 95 years old and you have a traumatic injury that involves a lot of bleeding, your bone marrow is going to start working to produce more new red blood cells. We never have to worry about our blood getting old, right? But what does get old are our cartilage, our bones. They're not quite as fortunate as our blood cells. They don't regenerate for the rest of their lives. We have telomeres, the ends of our chromosomes, and those telomeres get shortened as we age. And once those telomeres get shortened to a certain point, when that cell tries to divide, it makes mistakes and it creates unhealthy cells. And then the body has to destroy them. And eventually those telomeres are shortened to the point that the cell reaches what's called its senescence, meaning it stops dividing. For obvious reasons, the field of regenerative medicine is just rampant with different types of stem cell offerings to help us regrow cartilage and rebuild those knees. But let's talk about the 3 different types of stem cells, the sources of those stem cells, and what they might mean for your wallet as well as your treatment. First, we have perinatal stem cells, and these are ones that have been harvested from the umbilical cord blood and amniotic fluid. And then we have embryonic stem cells. Embryonic stem cells come from an embryo that is 3 to 5 days old. Now, there's a lot of controversy around embryonic stem cells, and I totally get it. And I am not here to debate the morality of using embryonic stem cells with you today. But I do want you to know that in 2009, the National Health Institute issued some guidelines around embryonic stem cells that they're only to come from fertility clinics where a woman's egg has been fertilized but never implanted into her uterus. As the donor, she signs an informed consent for those cells to then be used for science purposes. So we have perinatal stem cells that come from umbilical cord or amniotic fluid. We have embryonic stem cells that come from an embryo. And then we have adult stem cells. And adult stem cells are the ones that adults make that can be harvested from bone marrow, adipose tissue, and our blood. And for a long time, adult stem cells weren't thought of as desirable as the younger versions of stem cells, because maybe they might make errors in replication. They can't divide into as many different types of cells. But the world of adult stem cell research is growing and growing, and it's pretty exciting to see what's happening there. Because the fourth type of stem cell that we have is an iPSC, an induced pluripotent stem cell. Remember how I said a pluripotent stem cell is one that can become all 200 different cell types in the body. Well, some researchers in Japan at Kyoto University figured out how to kind of induce a cell, trigger a cell to de-differentiate into an induced pluripotent stem cell back in 2006. And there's a lot of different studies going on about the iPSCs, but they are not in, clinical use at this point in time. So to break it down even further, adult stem cells, we have mesenchymal stem cells, or MSCs. Mesenchymal stem cells can become things like cartilage, muscle, or bone. And then we have hematopoietic stem cells, or HSCs, and they tend to become red blood cells, white blood cells, and platelets. So what is available in the stem cell market today? Any physician can go online to a website and order a vial of stem cells, and you can, the pricing is widely different. The cheapest stem cells are ones that have been harvested from someone's adipose tissue or their fat tissue. All the way up to the most expensive stem cells are the embryonic stem cells. So a physician can go onto a website and purchase stem cells that are from bone marrow, from adipose tissue, from hematopoietic stem cells, and use those for injection purposes. So these types of stem cell injections from stem cells that are not your own tend to be a little bit less expensive, but they can come with more risks. A greater risk of rejection, greater risk of infection, and greater risk of even something called a teratoma, where you form a benign tumor that grows at that site, where those cells kind of did the wrong thing, basically. So let's talk about harvesting your own cells. That's called an autologous stem cell procedure. Autologous meaning you're using your own stem cells. A doctor can harvest your own stem cells from three different places, like we mentioned, from your bone marrow, from your blood, and from your adipose tissue. And that is the gold standard in stem cell procedures these days, to harvest from all three places. And obviously, harvesting something from your bone marrow requires an expensive surgery. So that type of stem cell procedure is typically $5,000 to $25,000 out of pocket. But that is considered the gold standard for getting the highest number of stem cells that are the most viable to use. And sometimes they might even take those stem cells from your body and put them into a petri dish and grow more of them in a lab condition, and then inject those back into your body. And if you're not into the idea of spending $25,000 for the gold standard in stem cell technology that still is not FDA approved, you can look at another type of injection therapy called PRP. That stands for platelet-rich plasma. And in PRP, a physician draws your blood, isolates the platelets, and then re-injects those back into your body. And when they inject those platelets back into the body, the platelets release a ton of growth factors into that area. And it is those growth factors that have a powerful anti-inflammatory effect and a regenerative and healing effect. PRP tends to be less expensive than stem cell injections, and typically it requires 3 to 5 visits in order to see the best benefit. And most users report relief for anywhere from 6 months to, a couple of years from doing a round of PRP work. And we still don't know exactly how stem cells can kind of see inside the cell or inside the body and know what to do and what kind of cell to become. But there does seem to be, evidence that the stem cells are able to sort of see and understand what the body needs. Again, how that works, nobody knows yet. And then the bigger question is, how effective are stem cell injections? The only stem cell injection that is FDA approved is using the hematopoietic stem cells from bone marrow to help make more blood cells in situations where someone has like leukemia or something where they're not able to make effective blood cells on their own. The rest of the world of stem cell and PRP is all still more research and more empirical evidence than it is standardized approved science. Because if you read something that is written by an orthopedic surgeon, they will say stem cells are risky and unproven, and the only thing that's going to really solve your problem is that joint replacement. You need surgery. And if you talk to someone who performs regenerative injections, they're going to say, surgery is really risky, and what you need to do is this stem cell injection because it works. People boast anywhere from 80 to 95% effectiveness in some clinics, and then other clinics boast effectiveness rates of like 55-60%. So I've read hundreds of research articles before making this video for you to see if there was any type of real consensus. And honestly, the only real consensus that has been made thus far regarding all the different stem cell injection therapies is that more research is needed. So if you are thinking about stem cells, you do need to know that this is still considered an experimental therapy. It may work wonders, and then again, it may not. In the Pain Eraser program, we give our clients certain supplements that have shown some benefit in increasing stem cell production. I did a video on that, on the supplements that I take for joint pain. And I really like to combine that with techniques using our dynamic neuromodulation, using our device technology, techniques that irritate the periosteum, the lining of the bone, so that we have new stem cells being grown inside our bodies, and we are at the same time irritating that periosteum, releasing those growth factors. That the growth factors act like attractants. They're acting like magnets, or like a big chemical signal that says, stem cells, come here. And so when we utilize that approach, we see some great results in, less pain and restored function, and it's all non-invasive. And the cool thing about that is that you can then use that device on multiple different areas of the body. So you can get that reparative effect happening in the shoulder, the knee, and the ankle all at the same time, all for the one investment in the program. And, with the Pain Eraser program, you have this device for the rest of your life. You get a stem cell injection and it may work great for a while, but your body then continues to kind of degenerate and fall apart as you age. And so then what happens in 5 to 10 years? You're looking at shelling out another $5,000 to $10,000 for another round of stem cell injections. Trust me, I have clients who've done that. And with this program, the beauty of it is that you get this sturdy, amazing little device. I've had mine for about a decade now, and it has never given me a single problem. And so you're then armed with something that can benefit you for a wide range of conditions and joint issues for the rest of your life. And I also like the fact that when you're part of the Pain Eraser program, you can take your device with you. If you go on vacation to Belize, you want to go skiing in Canada, you can take your device with you and you can give yourself treatments for those little acute pains that pop up at the same time. Just last week, my 6-year-old son had a stuffy nose and he came to me and asked, "Mom, can you bring out the zapper and give me a treatment?" Yes, he's 6, he calls it a zapper, but I was able just to treat some spots on his sinuses, and he knows that it helps him breathe easier. It will break up the inflammation in his sinuses and open up his airways. So there are so many great uses to this one tool, to this one program. And that's why I think it is a strong consideration to look at this type of a program first for anyone who is looking at potentially doing a stem cell injection procedure. Have you been curious about stem cells or regenerative injection techniques and not known where to start the conversation? If you've liked this video, leave a like and let me know in the comments. What have you been thinking about doing? What have you done that's worked? What have you done that hasn't worked? Let us know in the comments and let me know what else you'd like to know about this subject, because there's a lot more to it. And if you're interested in learning more about the Pain Eraser program, you can just click on See More, and in the description below, the link will pop up for the Pain Eraser and Rapid Recovery program, and that's where you can register to learn all about our non-invasive way of helping you heal faster from home. And if you want to take a look at those top 5 supplements that I mentioned for joint pain, take a look at this video next. And if you're interested in seeing a demo of how we treat a bone-on-bone knee in the Pain Eraser program, you can click on this video next. As always, we wish you optimal health and happiness. We thank you so much for watching, and we will see you next time.